A handful of the people we saluted as a country yesterday never got to feel that appreciation. We've learned 9 people living at the King VA home in Waupaca County died from COVID-19 just since Friday. News 3 Investigates Naomi Coles dug into the nursing home records today. And Naomi, what did you find?
Eric, to put that number in perspective, there have been 34 COVID-related deaths at King this year. So that means more than a quarter of King's deaths happened in just the last 6 days. At King Veterans Home,
King does have a fairly significant outbreak. They're a large campus.
That outbreak started slowly, mostly with staff. Reports from July show a rising but small number of staff cases. Numbers stayed low in August. Early in September, things improved. At one point, no residents were in quarantine. But since then, the case counts and deaths are rising.
The staff has done a remarkable job of sticking with it, taking care of our members, doing the best that they can.
Diane Lynch with the State Department of Veterans Affairs says they've had to turn to federal help to mitigate staffing shortages.
Prior to COVID, long-term care has seen a significant struggle with having adequate staff. Then you add COVID in, and that challenge becomes even more challenging.
In line with other nursing homes around the state where citations follow outbreak inspections, safety procedures at VA homes have evolved. At Union Grove in Racine County, inspection records from August found times where staff weren't wearing full protective equipment with residents. After an outbreak with 10 deaths in August, Congressman Brian Stile called for a federal investigation, which today he said still hasn't happened.
Those were one single occurrences. Union Grove's citation was cleared by the Department of Health within the time frame allotted.
Back at King, a June citation shows difficulties with communal dining and getting residents to wear masks.
And it is very difficult for members with memory loss to remember or to want to have a mask on. And we remind the members to wear that for their protection. But they have a right to choose not to. There are some that don't.
Later inspections gave King a clean slate. But as deaths keep rising,
our members have been without their families for almost 9 months now.
It's getting harder and harder for veterans to cope.
Some people have seen a slight decline in their overall well-being because we all thrive on family interactions.
I spoke with legal counsel for the Ombudsman program, which takes confidential complaints from the public and advocates with facilities on the public's behalf. I'm told that many of the complaints this year about the VA nursing homes have, understandably, centered around visitation concerns.